Thanks for attending the China Forum. And I'd like to have the first acknowledgement to the organizer of this meeting, OneMedForum. I have met Brett several years ago, I think almost 4 to 5 years ago. He has been organizing the conference even before then, and he has been very passionate and optimistic about China healthcare front. And from there, I think we have arranged the first China Forum and the conferences to have the meeting attenders and giving speeches. And so that was the fourth China Forum, I believe. And we certainly will be happy to give you the updates. Second of all, is I'd like to thank the panelists who, in their precious time, can come here to attend the panels. James Huang, Mark Xu on my left, and Ko-Wen Jing. I'll let them to introduce themselves, which certainly will save a lot of vocal for today, because I think a lot of people have meetings and probably have been stressing out their vocal cords quite a bit. All right, James.
Sure. Hi, everybody. My name is James Huang. I'm with Kleiner Perkins in China. We have roughly $800 million under management. We're currently investing all of our second fund in China, and roughly half of our fund in our second fund is invested in healthcare. Right now in our portfolio of companies in China, we have 11 companies in the healthcare space. That's a little bit about our fund.
Yeah, I met James when he was at Vivo. Right, that was in Palo Alto, and then also specialized in healthcare. And James has invested in my company. Just a few sentences about my company. It's ticker TPI, Tianyin Pharmaceutical. We are a small generic company located headquartered in Chengdu, and we sell primarily in the domestic market in China, doing about $60 to $70 million a year. And net margin about 9 to 10%. We got listed in 2008 with the ticker symbol TPI, as I mentioned. I'm the Chief Financial Officer of the company and also Chief Business Development Officer. So I've been attending OneMedForum for several years and looking for potential collaborators, M&A targets, and also potential investors. Let's have one quick update on the China healthcare. We have seen the generic sector in China healthcare has been pressured quite a bit for the past few years. And there is a consolidation stage that we are experiencing. But for our company particularly, actually have weathered the storm pretty okay. And the sales have, after 1 year of dip in the sales, about 30%, it's gradually coming back up. I'll try to give you more updates on the recovery and we see the trend as the panel goes along.
Okay. Yeah, good afternoon. My name is Mark Xu. Chinese name is Xu Yingling. So James and the other James and I actually went to the same MBA school at Stanford, but he's probably a little
2 generations older.
Well, half a generation older. But James has been my idol and mentor for quite a few years. So I'm with Trout Group, which is probably one of the largest investor relations and advisory firm based in New York City. We only focus on healthcare, so small to mid-sized companies. We have currently about 70 clients. Market cap anywhere between $20 million up to $10 billion, so it's the sweet spot we are in. So we don't compete with the bigger firms, so we stay in our sweet spot. I'm the general manager for Greater China, primarily for the mainland and Hong Kong. Prior to Trout, I was an entrepreneur, co-founded 2 companies, one of which merged with the Pharmacyclics about 5 years ago. Another one merged with a Taiwanese-based company about also 5 years ago. So I had a little bit entrepreneurship and then moved on to professional services and have been with Trout for about 5 years. It's been a great honor to be here. Thank you.
Okay, my name's Ko-Wen Jing. I'm a Shanghai-based healthcare entrepreneur. Originally a pharma marketing guy, and then a CRO entrepreneur in Shanghai. So I was there in the early days and then heydays of CRO. I'm now a born-again medical device guy. I'm doing a device company, also doing a healthcare service company in the eye care ophthalmology space. In my spare time, I show up on panels like this.
Thanks, Cohen. This is we have a pre-scripted topic. It's about first is the general updates on China healthcare market. Second one is something I favor quite a bit is on the China healthcare services market, which are private hospitals. And the third one is related. I think David was great to point out that there is animal healthcare, which is pet medicine. I have, when I was a banker before, I have actually worked with several companies in China, which ended up listed their name in Amex and NASDAQ on the animal pet medicine. But if we have time, then we go into that details. And the third, the last one will be the innovative front of China healthcare, because China had previously been being interpreted as a manufacturing, base, manufacturing of API and stuff. What is the innovative front in China healthcare that hopefully that we have a multi-talent panel that can update us with those development. So how about I start with you? Because you're a bear in private hospital, privatization of hospital services, right, James?
Yes, I'm actually a super bear.
Super bear.
I think in China, when people look at hospital deals, you can see different kinds of models. There are those that are truly building hospitals from the ground, from getting the land, getting a license, build the real buildings, from soup to nuts, from very beginning to the end. And it's a very long process. To get all the licenses required to actually to operate a general hospital in China at the level 3 level, it takes about, I would say, 5-7 years to obtain well over 150 licenses. So it's many years of investment. And typically, these are the types of deals that are most suited for private equity firms and some of the big real estate companies that have a lot of cash that they have generated from their real estate business, and through a lot of government incentives, they can get additional land, which are extremely valuable in China, and that's more suited for that. There are those models that really favor more of a traditional operator type of model. And you could see folks that take these fairly inefficient hospital in the what we call more level 2 hospitals, and they try to figure out ways of bringing good management practice into these hospitals, upgrade the hospital capital, and through a whole bunch of relationships to be able to gain control of the hospital and therefore cash flow. And that's the other type of model. I think over the years, I've seen some of these models. I think it's very much real estate driven. Because by acquiring the real estate related to these hospitals, these deals become quite valuable over time. Because one thing's for sure in China is that land continue to appreciate. Physical assets over time continue to appreciate. And that's what make these types of, especially in big cities where land is scarce, these types of deals really make sense. I'm a bear because I care about healthcare service, real service to the patients. And I'm not seeing great improvement in terms of services yet from some of these models. So therefore, at the present time, I'm still a bear until it's proven that the new ways of building hospitals, trying to upgrade these hospitals, actually deliver much better patient care to patients, then at such time, I will become a Super Bowl.
Thank you. Well, I'm a bull already. So my analysis is that if you look at hospitals, right, there are about 25,000 hospitals in China. And there are actually 10,000 of them are private hospitals. So if you look at the number, you say, hey, this is pretty nice, right, 50-50 close. But if you just look at the resources, the public hospitals are taking 90 or 93%. And David's number was 99% in terms of government funding. So that will restrict a lot of the private hospital could do, right? And especially the physicians. So that's why when you say privatize, that you're a bear because they just don't have enough type of equipment and then the resources like physicians to serve these hospitals. So I think that the specialty hospitals may be where to go. So if you're a fund manager or private equity or a company has loads of capital that would like to go into those markets, I think that certainly bear in mind, yeah, the real estate, right? There is asset appreciation behind all these heads, right? And so you're acquiring assets, even though it's medical usage land, right? Not residential, not industrial, but it's a medical, particularly designated for medical. But the hospital lands or the privatization of those lands are rare. So when you get a hand of that asset, usually it will cost you probably at least 100 million RMB, right?
So I tend to agree with you that in the specialized area, specialty hospitals, there are some hope that some of the operators could become quite good and actually quite favorable in terms of the business performance. I mean, we're a big investor in Real Dental. It's the largest high-end dental clinic in China. We have 32 clinics, 2 large dental hospitals, providing the best dental care in China. And it's a model that works because we are able to pay the dentist and have the right kind of incentive system. But I think in the general hospital setting, whether it's public or private, one of the issues that we face in the public hospitals is that despite the fact that they do get 90+% of the resources, but from the pure revenue perspective for the hospital, actually only 10% of their true revenues actually come from the government. So the other 90% of these hospitals, the revenues all come from primarily a little bit from insurance, primarily from patients out of pocket. So these public hospitals actually function as if they are private hospitals. And so that's why so much of the usage that we see for the consumption is there's so much incentives for the physicians and the hospital to overprescribe and because so much of the income is coming from making money from all the patients. And as a result, we're not seeing very good patient care at the very end. And that's why I was saying you almost have to separate the specialty hospitals, some of these, what is eye care, dental care, cosmetic area, we're seeing diabetes, some of the newer areas from the traditional hospitals. And I think I'm really, I see them separate.
I'm actually personally invested in eye care ophthalmology company, which has been in business since 97, 98, the first LASIK eye care company, joint venture with the largest teaching hospital in Shanghai. And I think they're still, I agree with James, general hospital is not, at least from the entrepreneur, betting your own money or angel run, Series A run, no, I wouldn't touch them because just the sheer size of it, the bureaucracy involved, it's a lifelong calling. You don't want to be bogged down getting 100 jobs. But certainly there are pockets of specialty pharma you mentioned. And also if you look at healthcare, there are really two, if on one end of the spectrum, which is those who treated life-threatening or really severe, we're talking about oncology, cardiology, serious stuff. On the other end, it is totally lifestyle-driven, out-of-pocket, which will be a big chunk of eye care, which, LASIK and all that. And then dental, obviously, is mostly, and cosmetics, and a lot of the kind of a premium service. So if you're a private hospital operator, if you are on that serious medical end of it, then you go head to head with the biggest teaching hospital who have 50, 60, 100-year reputation building. And the other thing is the mid-age, late 30, 40-ish frontline surgeon intervention cardiology are still mostly under the employment of this hospital. It's very difficult to compete with them on that. And when people have a severe disease, they care less about, how does the doctor remember your name, or does the nurse smile, or, But on the other side, the lifestyle side, it is you excel, you win by the quality of service. That's where private hospital can win versus a big teaching hospital any day of the year. So I think the opportunity is mostly on the lifestyle-driven side, self-paid, specialty pharma. I mean, not specialty pharma, specialty care. It could be a severe. I was looking at kidney dialysis for a while. Yeah. It is certainly reimbursed and severe disease, but I think it's the quality being offered, because this patient has to go back there once every half a day, once every 2 days. They basically live there, so the quality of service impacts on their life. So I do see there are opportunities, but are there general hospital-ish primary care focused for premier service doing well? Yeah, United Family. I mean, Roberta have been doing this since late 90s. Yeah. But I don't know, financially, I think early days they got pretty tough for many, many years. But yeah, so I think there are pockets of opportunities. I'm sorry, I talked too much.
No problem. And I think I learned a lot from the three gentlemen before me. I don't have any detailed personal experience in terms of hospitals other than as an end user. For a project, I spent a bit of time in Suzhou, which is a well-developed city near Shanghai, and I got to spend some time in the hospital. I think if you look at a general hospital in a well-developed city, affluent city, they actually, some of you probably have been to a Chinese hospital or maybe not, but if you go to a general hospital there, it's very crowded, it's very busy. But on the 6th floor of the general building, they have a special clinic for expats and also for the VIPs. So I actually, poked a little bit, basically charge, I think, 50% premium. So if you have a general surgery, 1,000 RMB, they will charge about 1,500. So obviously it's very cushioning, it's very nice, the staff is bilingual, and you get charged a premium. I think the private hospitals basically are targeting that niche customer segments. If you look at the general income of the Chinese population, we call it MAC, the median to affluent class, is growing pretty rapidly, and that's defined as the annual household income about 75,000 RMB. So I think these are really the target customers of these patients of these current or future clinics. That's from an end user perspective. If you look at the ones that actually have been investing to general private hospitals, there's one that I know of in Suzhou. It's called Zhoulong General Hospitals. It's invested by a Hong Kong conglomerate about 10 years ago. I think at that time it's already, the total investment is about 1.9 billion RMB, and that's about almost $250 million 11 years ago. So unless you have that kind of capital committed to build up a new general hospital in China, that's a single hospital, that's not even a chain, you should stay away from investing to a general new hospital. Instead, maybe a small chain of like the dental special clinics, 10 to 15 physicians, targeting the ultra wealthy or the median to affluent class. That's the way to go in terms of your return on investment.
Yes, the other thing, if I can add, is for the service side, also general hospital, one thing is takes a lot of capital. There is actually a lot of domestic money. Very interested in the service sector. Some of them is, like James said, is if you scratch hard enough, a lot of project in China is real estate project in disguise. So with this audience, I'm assuming most of you are Western American-based companies. When I was talking to my lawyers, lawyer friends, I said there's a legal arbitrage for the entrepreneurs in China, because sometimes when the Western big investors, when you look at a project, your counsel would say there's no legal basis for you to do it. What he means, there's nothing in the law explicitly say you can do it. But when people like me look at the project, we wouldn't do anything illegal, but we say there's a legal basis to do it because there is nothing in the law says you cannot do it. So what happens is people like us or domestic investors would do things as long as it's not explicitly banned by the law. And then 3-5 years later, law changes and your counsel say you're allowed to do it. And then we already build a piece and hopefully we can sell that to you guys for a good markup. And we did the early hard work, so it's worth it. So I think it's an evolving thing. I think there's a state council, 国务院那个7条关于 healthcare service, encouraging private sector involvement.
Yeah.
But of course, from 国务院 trickle down all the way to the cities and provinces will take a while.
And Kevin, that's why your example is very applicable to what's happening in the dialysis sector in China, because by law, no province in China or no city has ever granted dialysis license to standalone dialysis center. They always are connected to hospitals. But the interesting thing we have observed in China the last 2-3 years are the entrepreneurs getting together with hospital, trying to build some of these ancillary, but also under the hospital's license and guidance to do so, but it's really in preparation that when the law does change, they could then, together with these hospital operators, somehow to sell these for a big profit. And that is what's happening that we're seeing now in the dialysis sector as they gear up for that. So I think that's a very good example sometimes of what we're seeing very dynamic in China, the way people are arbitraging these opportunities.
Sorry. Just add on what James said. When I was at China Medical City for my second startups, China Medical City is a technology incubator in Jiangsu province. So in the end of my 2 years there, actually the CMC, China Medical City, actually acquired a local hospital. Basically, the transaction doesn't involve any cash. So basically, the government said, look, we want CMC to be a major, internationally known technology base. So we'll just basically assign this hospital in the city to be part of CMC. So we actually now, if you look at CMC website, they actually have say, well, we have technology incubators. We also have a fully functional hospital under our brand. And that transaction doesn't really involve any capital. So that's another way to look at if you have that kind of connections or influence to the government, you might be able to get a very nice piece of the asset. Maybe underperforming, maybe it had a lot of leverage, but you can get a piece of the asset literally with no upfront payments, and then but with a promise to turn it around, and then maybe contributing to the local economy. So that's another way if you have the resources to do it, but have limited upfront investment. You need to cozy up with a government entity somewhere, and then you might be able to get a piece of the asset with virtually no upfront payment.
Okay, great. So we have about 15 minutes, and I'd like to have the panelists to give 1 minute of your summary of what you see the forecast for the China healthcare for the next 5 years. And then it doesn't have to be a quantitative, it could be qualitative. It's nice, it's going to be dismal or something. And for you, what do you see the most opportunity reside? And for an American entrepreneur, or a US company, or a US fund trying to get into the market. So it's a lot of questions, but hopefully you can summarize in a little bit over 1 minute.
I think in China, over the next 5 years, we'll start to see innovation coming out of China. We're starting to see a little bit of it. I think we'll see a lot more of it because as a venture capitalist, we see a lot of entrepreneurs that have started companies in the past couple of years, and some of them are very focused on developing new drugs. And developing new drugs is hard. It takes time, and the risks, the probability of success is no different from the Western world. But I think we'll see more of that over the next 5 years. I think the tender process will become much more clear, become much more market-driven, because the government is really experimenting with having third party involved in the tender process. And in that is a way to ensure higher quality. And I think that's really good for companies that are focused on innovation. And so that a lot of the generic players that traditionally have flourished in their local markets will come under a lot of pressure. So you will see the bigger gets bigger, and some of the local small players will still get eliminated. And you truly have to have the cloud. In the same way, it's only generic manufacturers, but large medical equipment manufacturers, those with channels, they know how to do tender process, they're very efficient, and they will also thrive. And also government's really protecting a lot of domestic medical equipment manufacturers. So that sector will continue to do well. We're also going to see a lot of fruits of the labor of the government's investment to upgrade the hospitals in the rural area, and you will see, as a result, a lot of the equipment, at least in the level 2 hospitals, those are all going to be upgraded, and that cycle has started, and you'll see a lot of that continue to progress. So as a result, the consumable in China will continue to enjoy very good growth in terms of volume, but from the price perspective, I think they'll continue to really come down. So I'll leave it there for everyone else to add the rest, but those are some of the highlights.
I think James covered pretty much every angle, if I may add a couple. Again, using my MAC medium to affluent classes, the number of MAC population in China will grow pretty significantly. So I saw statistics somewhere there that in about 6 years, there'll be another 200 cities in China within the same disposable income as in Shanghai today. So it's a major growth in wealth. I always joke with my Chinese friends in Shanghai. I say, well, just sell your little condo in Lujiazui, the financial district. You can get 2 in Manhattan. You know, it's pretty easy to do. But there's there's a lot of wealth over there. I think that the spending on health care will significantly grow. At about 20% CAG over the next decade or so. So opportunities there. I would advise to the Western companies, whether European or Chinese, American. So if you're small to mid-sized and you're not in China yet, you should seriously think about partnering versus going alone, because all the big pharma has already been there. So if you are not there yet, the best way to enter now is probably through partnerships with a local company such as Tianying versus setting up a new team, going your own way. It's a learning process that I learned myself 5 years ago. So if you're small to mid-sized Western company, partner versus greenfield, that's better. For entrepreneurs, I was a couple times myself. My only advice is that raise enough money in Series A, meaning that $3 million or €2 million minimum. So if you have a smaller tranche, try not to start a new company, because that's, I think, really the minimum it takes to bring you to the next partnerable milestone. That's my only advice if you want to start a new company in China.
Yeah, I think you should do something there. For all the macro reasons. A US worth of population is moving into the city in the next 10 years or so. China will be the first major country in human history that become old before they become really rich. Other countries become rich first and become old then. Yeah. And the third thing is the disease spectrum. We Chinese are like a vegetarian because we can't afford meat through the millenniums. Now, this herbivoral species is being answered by the high-fat, high-cholesterol, high-protein diet. So you see diabetes, obesity, all these diseases. I started involved with China pharma business starting in '95. Half of the drug market was, in fact, antibiotics. Now, antibiotics is about 10–15% of the market. So you see a compressed switch from a poor country disease spectrum to that of a developed country in about 15 years. All these are there. As for specifically what you do, don't decide too soon. I called some of my American European friends, make the first trip, the second trip to Shanghai and Beijing, gets overly excited. I call this China Virgin Syndrome. You see all the shining lights of Lujiazui, think anything's possible. It's actually very hard. So take some time, find somebody you feel comfortable with. But opportunity is there. Could be in drug, could be in device, could be in service. Don't decide too soon. But you need to be there.
Yeah. In order to accomplish something, you need a plan and not quite enough time to do it. All right, and now the floor is open for questions, and I'll roaming around if you have questions.
Since we're talking about predictions, what's your idea about the likelihood of having, say, some private clinics forming by those domestic doctors? What we see in this country, for example, the family care, all the way to Mayo Clinic, are they going to happen? I mean, and if there is any investment opportunities there? Not government-run huge hospitals, but small clinics maybe in smaller towns.
So one of the problems in China that's very different from the United States is I think most of us, when we grew up in the States, we do our homework. These days we can go internet. There are many ways to find out what for specialty, who are the best doctors, and as long as you have money, you can go see them, whether in a clinic or they're in the hospital, right? Okay, China is very different. People know China by the name of the hospital, not by the doctor. Okay, that's a very important concept. So all I know is if they are sick, they should go this best hospital. Okay, and they think every doctor is good there. So that's first of all. The second of all, I think a lot of the best, until we had this anti-corruption campaign recently, I really think most of the doctors at the top of the hospital they make almost all their income from all their extracurricular activity. And one of the problems with that came with that was that they didn't have to go to a private clinic in order to make that actual income, because that's actually pale by comparison to, let's say they give a dinner talk for a pharmaceutical company for maybe an hour. That income is so much more than they have this clinic and they see patients every day for a week, okay? So that was the issue that we faced with private clinic, that you can get incentivized. So when government tried to give the incentive for the physicians so that they changed the law so that the doctors can spend 1 day of the week to go to a private clinic to do so, that did not encourage the development of private clinics. So I think within the 5-year horizon that we were talking about, I really don't think you will see much of that. I think there's going to be, you have to see major policy changes at first to figure out how to address the income issue for the doctors, right? You cannot forever pay doctors, basically in our terms, maybe around $600–700 a month, and to expect them to practice at a good hospital as their base salary. That doesn't work, right? So a lot of those things have to change before you could actually physically think about building private clinics, giving incentives, because even the income they get from there, they won't be able to get it because the reputation resides with the hospital, not with the individual doctor today.
Then what is the price then?
Well, the problem in China is historically, let's say if a good example, from weightlifting, I injured my neck about 18 months ago. So I went to see 3 of the best orthopedic surgeons, and because I have the network, I can do so. But in China, to see orthopedic surgeons for that checkup, normal person have to give a hongbao, a red envelope, just to be able to see them. This is not before they even sit down and look at you. I mean, and then before they actually operate on you, there's another fee. So you have to remember, it's not the salary, it's all these other income just to be able to have access fee. Okay, so maybe I have connection I don't have to do that. It's just some nice present or other things. But that is the reality. So how do you convince them to go to a private clinic to practice when if they are going to operate on somebody, they'll get 10,000 RMB even before they even do anything, right? Those are some inherent issues that we have now in China.
Yeah, I think certainly there is a trial regulation in a few city provinces like Beijing and Zhejiang called 多点执业 that allow the doctor to have multiple appointments in addition to their government, say, teaching hospital appointment, which they really like to keep if they can keep it on a part-time because they got a professor appointment, which enables us to be the member of the, say, National Cardiology Association, which makes them visible to the drug companies and device companies. That's a status thing. But what people are trying to do, because the government basically feel they really cannot triple, quadruple your salary to reflect what you truly should be paid. That's too much money. So what I think is being on the trial basis is say, how about you work in the public hospital for 3 days, and the other 2 days or 1 day go work for a private hospital, and they will charge whatever patient the market will bear. And say you're a cardiologist, you do, say the private hospital that have cath lab, you do your stent, there. So in that case, you probably make more in the 1 day over there than the 4 days in the public hospital. It is being tried. If this is going to be nationwide rolled out, I think it will have a huge impact on the public hospital. So the public bigger teaching hospital precedent is fighting this teeth and nail, say, over their body. Because just think about it. If I'm in the teaching hospital for 3 days, and I'm working a private hospital for 2 days, teaching hospital, I get a nominal salary. I can certainly negotiate a revenue sharing deal with a private hospital because these are the patients I bring in. So I will tell my best hospital, said, I'm there on Friday, don't do your procedure here, see me there on Friday, and so you will direct, so that's going to have a huge impact. Yeah. I think that's probably the only way because the government doesn't have to pay them necessarily, and it's above the board, and so they're no longer serving as a marketing arm for the product industry. I think that's probably the best solution in the short term.
Yeah, but still it's so hard to get these very good doctors to form what we see in the United States, these physician groups, these are small, general care type of private clinics. There just isn't enough incentives to do so. That's one of the issues. It's
yeah,
really
they
hard.
actually probably don't come to institutional VCs because you guys have too much due diligence and questions. So we'll just get a few real estate developer friends together, put up the money, and just go ahead and do it.
Maybe.
Hi, we've heard about the great opportunity in China and also some of the complexities of getting products to doctors and so on. I've heard in the press and from my partners in China that there is the idea from the government to consolidate distribution of products in China. Obviously that could have a great impact on the commercialization of opportunities within China. Do you think there will be this drastic change within the infrastructure of the Chinese market, or any other government policies which may affect the potential success of products in China?
Yes.
I'll just make a quick comment on that. I used to work for McKesson in San Francisco about 11 years ago in their marketing department. So I still remember the days when we were talking about this great land of opportunity and we should get a piece of that. And McKesson obviously is the largest pharma device distributor worldwide, Fortune 52 company. So
Cardinal bought somebody.
Correct. So I think there are two angles to your question. Obviously, the multinationals are already, AmerisourceBergen and then the McKesson are not taking a lead in that respect. But Cardinal Health, being the boldest of the big three, has already acquired the Zuellig Pharma, China. And I think they acquired another 5 companies over the last couple of years. So the multinationals are already positioning themselves for a piece of the pie. I think the local companies are playing a different ball game because most of the local companies actually have a government, either the central government or regional government support. So Sinopharm, Guangzhou Farm, Shanghai Pharma, these are all major state-owned entities that have tremendous resources. So even some of my current American clients, when they want a medical device distributed in China, they ask me, they say just go to talk to Sinopharm because they have unparalleled resources. Forget Cardinal China. I mean, Sinopharm beats Cardinal Pharma hands down, no question asked. So the domestic SOEs are controlling the 80–90% of the market. And it's really a government, I think it's a government game. So you have to have government backings to get a GSP license, good selling practice license. They don't issue license at will. It's really about relationships. I think it's best to partner with a local company, like a Sinopharm or Shanghai Pharma, to be able to get a piece of that.
Or stay the hell away from it. Do something.
Well, McKesson ABC decided not to get in, so that's fair too. So.
I think that I'm not sure if your company or some of your clients are interested to go into distribution sector in China. Unless that you acquire a good standing, well-operated company, I wouldn't recommend that you go in there on your own. You already got 15,000 players there, and then the last year I asked Cardinal people, because they did acquire a few companies, they said that they screened the 15,000 company and they got 150 targets. And there's only in that 150 targets, they acquired 5. So that was very few. And then a lot of them, and I spoke with, because we are in Chengdu, right? So it's a 1.5 tier, second tier city. And there's a CEO of a distribution company came to me. He said that he made, for the 10 years, he made about $5 million. So 30 million RMB. 30 million RMB, but it's all in channels. So if he withdraw that cash, the company has to close because he makes money by giving out the 90 days or 100 days of accounts receivable from the hospital. So he has to stay, the capital is locked in. You certainly wouldn't want to acquire that company, right? So, you just wait it out. I wouldn't expect, but med device, I thought it was pretty good. I think med device sector.
I stayed away from the for lifestyle decision. In China, that field that's a drinking job.
That's right.
I have done my drinking duty for a major pharma in 98, 99. I can do it holding my breath, but I just don't enjoy it. So I get the hell away from that field.
I agree 100%.
We run out of time. Thank you. Thanks for coming.
That is so true. Kevin,
要喝酒的，
要喝酒啊，
知道的，
可惜哦，
受不了这个。
可惜哦。